Hello everyone. Today we are going to learn about circadian rhythm sleep disorder. Myself Vinoli, working as a lecturer from Tippalam College of Nursing. Let's get on to the video. Let's see the specific objectives of the topics. Introduction about circadian rhythm sleep disorder, physiological process, prevalence of sleep-wake disorder, causes and symptoms and various types of the circadian rhythm, and delayed and advanced sleep-wake phase disorders, and irregular sleep-wake rhythm disorder, and non-24 hours sleep-wake rhythm disorder, shift work disorder, jet lag, and 7 ways to risk circadian rhythm, lifestyle changes. What is circadian rhythm sleep disorder? According to the American Academy of Sleep Medicine, International Classification of Sleep Disorders, the circadian rhythm sleep-wake disorder occurs because of an alteration to the body's internal timekeeping system and the clock's inability to entrain the roughly every 24 hours or misalignments between the clock and a person's external environment. It is basically a body clock inside which is responsible for the sleep and awake pattern in a day-to-day life. And not only that, it is also responsible for a proper hormonal release like a stress hormone, cortisol release, as well as maintain a body temperature and a healthy digestive system. Circadian rhythm, to be simple, is generally reactions given by the body in response by the light and darkness. If you are not in a proper sleep, you may have a physical, mental, as well as a behavior changes in the day-to-day life. Coming to the physiological process. The circadian rhythm is regulated by the composed of the clusters of proteins known as the suprachiasmatic nucleus of the hypothalamus in the brain. These cells respond to signals of light and darkness from the surrounding environment via the optic nerve from the eyes. The light stimuli then trigger the signals from the suprachiasmatic nucleus to other part of the central nervous system and to regulating the hormonal activity and body temperature, eating and digestion and other mechanisms that plays a main role. For example, when eyes are exposed to higher intensity of light in the morning, the suprachiasmatic signals for the brain raises the body temperature and increasing the production of cortisol hormone and delay the releasing of the melatonin hormone. In humans, there is a special nucleus inside the brain known as suprachiasmatic nucleus. This is located in the hypothalamus where the signals is received from the retina of the eye. And the retina of the eye have the ganglion cells and which contains of photopigmented and known as the melatonin. And this melatonin receives the informations as how much light has been entered to the retina. The retina of the eye process of signals to the pineal gland as how much light has been received, and pineal gland secreted the melatonin. In the darkness, the melatonin induced with the proper signals from the retina to the pineal gland. If you are exposed with the light, then melatonin level not secreted. So there we faced some diseases like insomnia or sleeplessness disorder. What is a disease? It is nothing but the toxins or all the whole residual which is staying inside each and every organs, which is going to be a disease. So fundamentally, according to the nature, each and every organs cleanse out in one particular time, which is known as a biological clock. So here we are entered into the biological clock. First, we'll start with the early morning 3 to 5 a.m. It is a major time where the much of the oxygen goes to the lungs and lungs has been regenerated and cleansed. So, the persons who have a chronic lungs obstructive disease like wheezing, asthma, common cold, etc., may have a severe cough, especially in the time between 3 a.m. to 5 a.m. where they get up and sit keeping coughing, which means that the lungs has been cleansed out. it is the proper to do the pranayam as well. So who are all having any lung problems can do breathing practices at this time to keep your lungs healthy. Next, come to the 5 to 7 a.m. It is the major time where the much of oxygen goes into the GI tract, especially to the large intestine. So, it is a special time to cleanse the GI tract and expel your bowel movement regularly. Next, we come to 7 to 9 a.m., where the oxygen, excess of oxygen, goes to the stomach. So, stomach's ready to preparing acids, enzymes for food we eat to digest. For always better to have the breakfast between the 7 to 9 a.m. The next is 9 to 11 a.m. So, this is a time special for the spleen. The spleen is to prepare RBC cells by detecting and to digesting the nutrients what we eat in the breakfast between the 7 to 9 a.m. So always better to finish your breakfast 7 to 9 a.m. Next come to the 11 to 1 p.m. This is the important time for the heart. So here the heart is rejuvenating and cleansing the time. By this time the proper hydration and stress-free environment to avoid the heart attack. Because most of the heart attack have been recorded major this time for 11 to 1 p.m. So be careful to avoid stress, anger, and to keep hydrate yourself. So blood circulations to is maintain the good heart. Next coming to the 1 to 3 p.m. That is our favorite time. This is a time going to be a lunch time. So this is a proper time where the small intestine active absorb and all the nutrients what you eat in the lunch. So keep maintaining the same lunch time in 1 to 3 p.m. So 2 to 3 p.m. the small intestines absorb all the nutrients, micronutrients, everything, and to maintain the proper the blood nutrition. Then coming to the 3 to 5 p.m. this is the major time where the urinary bladder is more active. So in this time, the particular time after you lunch, make yourself hydrate and keep on passing the urine. Then coming to the 5 to 7 p.m. This is the major time as functions for your kidney. So kidney is ready to cleanse out. So in this time you can hydrate yourself and urinate also. Urinate and also can practice any workout or exercise and to cleanse out the blood toxins even through the sweating. Coming to the 7 to 9 p.m. So this is the time for pericardium and not to eat after the 7 p.m. So because the pericardium has to cleanse out and regenerator and cell for the healthy heart. And also try to maintain this time dinner time before the 7 p.m. And coming to the 9 to 11 p.m. this is the time for gallbladder. It is the time the 9 o'clock. Arrange yourself a little back to sleep places and avoid please avoid your mobile phones and lights and etc things. So the melatonin secretions good to have and good quality of sleep, and this is the time the gallbladder going to be active and flush out all the bile secretions intestines in the pitta soda and to maintain the healthy lifestyles. And finally coming to the 11 to 3 p.m. and so the 11 p.m. if you wake up there comes the some liver failure, fatty liver and improper liver functions. If you are awake till 1 o'clock or 2 o'clock you might have fatty liver, hormonal imbalance, diabetes, hypertension resulting in cardiac arrest. So better to sleep in the time and maintain a proper healthy life by following the circadian rhythm. What causes the circadian rhythm to be disturbed? Because if we have a stress, a regular sleep scheduled, sometimes lifestyle changes and mental health disorders and physical pain and some taking medications and some neurological disorders and some age related things and other sleep disorders and during the pregnancy, so the circadian rhythm will be disturbed. What are the symptoms can be seen if the circadian rhythm sleep disorders? Because the people having first difficulty falling asleep at night time, because the night time we need the melatonin secretions, because due to the lifestyle modifications or using the mobile or doing some other works, waking up in the night time. So it's continuously, if you're following, difficult to falling sleep will be happen. And waking up during the night time suddenly and waking up too early, actually the 3 to 5 a.m is the wake up in time to do the pranayam, yoga and breathing exercise as well. But waking up too early, one of the symptom. And not feeling well rested after the night sleep also, because very disturbed sleep will be there during the sleep. And daytime, maybe sometime that tiredness and sleeplessness will be there, because during the sleep time only our body will be cleansed out and regenerated the all the toxins, blood cells. So if not proper sleep, definitely the daytime tiredness and sleepiness will be there. And coming to the irritability, sometimes depression and anxiety will be there because of the improper sleep, and difficulty paying attention, sometimes attention orientation also sometimes disturbed because of the sleeplessness, and focusing on the task and remembering, sometimes memory loss, and increased error and accidents happened, and ongoing worries about the sleeps. So these are the symptoms as can be expert if the circadian rhythm sleep disorders happened. Coming to the types of circadian rhythm sleep disorder. So, based on the American Association of Sleep Medicine classification, the separate types of circadian rhythm sleep wake disorders, including the following types is: one is a delayed and advanced sleep wake phase disorder, an irregular sleep wake rhythm disorder, non 24-hour sleep wake rhythm disorder, shift work disorder, and jet lag, and other circadian rhythm sleep disorders. Coming to the delayed and advanced sleep wake phase disorder. So, which means occurs when the person's sleep wake cycles are pushed back more than the 2 hours beyond what it is considered a typical sleep schedule. A derailed circadian rhythm can cause the people to struggle with the falling asleep at night and waking up early in the morning. And the people with this condition often suffer from lack of sleep, and if they have school or work obligations, and that requires a early wake up time. And many people with this disorders are considered evening chronotypes or night owls, and it is a prevalence rate for the young adults and adolescents is 7 to 16 percentages. Then advanced sleep wake phase disorder is essentially the opposite. The person tends to fall asleep and wake up more than 2 hours before their desired time. Advanced age is a major risk factor for this disorder. And in order to receive a diagnosis for delayed advanced sleep wake phase disorder, the patient must experience symptoms for at least 3 months will be there. To irregular sleep wake rhythm disorder. This disorder is characterized by inconsistent sleep pattern without a stable rhythm or entertainment, and to day or night cycles. And abnormal sleep periods can cause both difficulty sleeping and excessive daytime sleepiness and during the course of the day. And most people with irregular sleep wake rhythm disorders have neurodevelopmental or neurogenerative disorders such as Parkinsonism disease, Alzheimer's disease, or Huntington's disease. Also, the fragmented sleep cycles of this disorder typically yield a period of sleep that lasts 4 hours or less. As a result, people with irregular sleep wake rhythm disorders frequently nap throughout the day, which involves restlessness, agitation, or confusion that coincide with the sunset. And sometimes the sleep fragmentations may be more severe for Alzheimer patients who experience surrounding the National Institute on Aging. Leads to broad scientific efforts to understanding the nature of aging and to extend the healthy and active years of the life. To non 24-hour sleep wake rhythm disorder. So here also known as the free running disorder, non 24-hour sleep wake rhythm disorder occurs when the internal clock does not reset every 24 hours. As a result, a person's normal sleep period is constantly shifting, working, and it is away around the clock over a period of days or weeks. The people with this condition may have insomnia symptoms and excessive daytime sleepiness when their sleep periods don't match up with the schedule of their social and professional life. These disorders primarily affect people who are totally blind, and the eyes of totally blind persons cannot transmit as many light signals to the brain, and which is leading to the confusions about the time of day, and as a result the internal clock is often unable to entrain on a 24-hour cycle. So between the 15 percentage to 80 percentage of the blind people report sleep disturbances, and experts estimate half of the totally blind people have non 24 hour sleep wake rhythm disorder. A diagnosis requires symptoms that persist for the at least 3 months. Shift work disorder. The people whose jobs requires them to work partly and completely at the night often experience shift work disorder, which is characterized by insomnia or excessive daytime sleepiness. And the term shift work can apply to any shift that falls outside the traditional one, that is 9 a.m. to 5 p.m. And but the shift work disorder usually affect those who work late at night and early in the morning. So most people with the shift work disorder lose between 1 and 4 hours of the sleep for each 24-hour period. And adjusting to work once their shift behind can become the increasingly difficult over time. These disorders can be particularly dangerous because it is increasing the risk of accidents either at their workplace or on the road during the late and night or early morning commuting. So people with this condition may also develop ulcers and medicate and alcohol or sometimes drugs in the order to get enough to sleep. And estimates vary, but it is believed as many as 38% of shift workers have this disorder. It is equally prevalent among the sexes and different racial groups. And coming to the jet lag. Most people experience a jet lag after flight that pass over the multiple time zones. The conditions marked by the temporary sleep disturbances and daytime fatigue, and represents a transition period during which a person's internal clock needs to synchronize with the local time. The persistent symptoms can lead to insomnia and other more serious sleep disorders. Jet lag symptoms typically begins 1 to 2 days after the flight and can persist for up to a week or two. The jet lag is usually not a serious condition, but it can propel people into downward spiral if they do not practice healthy sleep hygiene during this post-flight period. Two other circadian rhythm sleep disorder. The disorders in the category are usually tied to understand underlying the health conditions. They resembles the other circadian sleep disorders listed above the terms of general symptoms, including insomnia, excess of daytime sleepiness, but patients do not meet the diagnostic criteria. So there are rare cases that typically requires Tyler and care from the doctor or sleep specialist. Prevalence of circadian rhythm disorders. Here, the most higher percentages, 54 percentages of the delayed sleep disorders happened. Here we have 7 ways to reset our circadian rhythm. What are the ways? The first, take the melatonin supplements if we have some sleeping disturbances, sleeping disorders. And second one is establish consistent healthy sleep habits. That's a bedtime is 9 to 9 o'clock, before the 9 o'clock, and avoid the caffeine content, coffee or other caffeine content, to avoiding the brain stimulator. And bright light therapy, avoid the bright light therapy during the sleeping time, and watch your meals scheduled, and then exercise regularly and make the adjustment to light. To take the adjustment lifestyle changes. Establish a regular sleep schedule, a sleep and wake pattern, but at the same time, relax and wind down before going to the bed, reading a book or meditating, or create a comfortable sleep environment, and avoid drinking alcohol or caffeine in the evening hours, and be finished with any heavy meals or strenuous physical activity at least 2 hours before your bedtime, and get out of bed if you are having a trouble falling asleep, and do something else until you actually feel sleepy. Avoid taking naps in the later hours of the afternoon and evening. This video will be useful for everyone, so thanks for watching.